and thank you to everybody for coming and joining us as we try this out. I just want to take a few minutes here to kind of set the stage of where we are in Ontario and in Niagara specifically, where we're going, and what, in my perspective, is where we need to be focused in the next while to be lowering the risk of COVID-19 in our society. So, obviously, the starting point of this is that what we're trying to do is avoid what we were seeing back in March, where we saw in Italy, we saw in New York, where the hospital system was overwhelmed by people who had severe illness from COVID-19, were filling up their hospitals and really stretching their hospitals' capacity. Obviously, many people, fortunately, have very mild illness from COVID-19, but if it's spreading widely enough in society, that fraction of people with severe illnesses will really start to multiply. And I've seen recently news stories in the United States where they're talking again about how many of their hospitals are again being pushed to that breaking point. We're fortunately far from that in Canada, and hopefully we will never get to anything resembling that. So I want to start here just by quickly, mapping out what the COVID-19 has looked like in Ontario. And this is really looking at daily cases in Ontario, averaging over 7 days just to kind of smooth out the line. And what we saw starting in March was kind of a curve that looked like this. And so, in cases were rising rapidly, the province imposed a lockdown that should not be, that's not quite right. The lockdown actually started more, this should be the lockdown. This should be stage 1, stage 2 is after that. But the point here is that the lockdown was effective at bending that curve and bringing it down. But there's, of course, a time lag before it took an effect. And as we went through stage 1 opening, which was here, and then continuing on in stage 2, of course, we are able to see cases continue to go down. Now, obviously, the way this lockdown worked is, of course, we broke up social interaction between people, broke the ability of infection to transmit between people, and so therefore we were able to reduce cases. Once the province went to the full reopening in stage 3, you can see very rapidly, within a couple of weeks, that curve has started to bend upwards, and then it slowly picked it up steam and then started to rise quite rapidly and has continued at that pace. I think it's notable also that since the province moved certain regions back into stage 2, we haven't really seen that curve really bend much. And so a big lesson I take away from this is that, of course, we're trying to find a balance where we limit social interaction enough in society that we can slow the spread of COVID-19. And we do that by both having some restrictions in society, as well as some voluntary behaviors. And the combination of that will hopefully be enough to flatten out COVID-19. And obviously from this graph, we can see it's not working.
Yeah, sorry to interrupt. We're not seeing your presentation.
No, that's my fault. Sorry, let me put that up then. I'm just going to correct the one thing I had wrong there then. Sorry, someone should have pointed this out earlier. Okay, now everybody should see the presentation, right? Good, I'm seeing nods. And so this is the graph I'm showing. The darker shaded region is when we went into lockdown, and we can see that led to cases coming down. The lighter shaded region was then into stage 1, and we see the line continuing to go into stage 2. And then, of course, once we come out of stage 2 into stage 3, we see cases rise quite rapidly in Ontario. And since reimposing stage 2, the province has not been able to really flatten out those cases at a provincial level. Looking locally at Niagara, it's a fairly similar picture here. Lockdown brought our cases down. We were able to keep them down. Actually managed for quite a while in stage 3 to keep them low, but of course they have now been rising, and we can see over the last week that very sharp rise now, where we're now basically hitting a higher peak than we were in the initial phase of COVID-19. And again, the key message here is what we're doing in Ontario to try and limit the spread of COVID-19 obviously hasn't quite been enough yet. And so whether it's in the form of more restrictions or more personal behaviors that break up social interactions and limit the spread of infection, that needs to be increased. Otherwise, we are likely to continue on this trajectory. So obviously the province has announced their new framework this week around how they're going to manage adjusting and tightening of public health measures, and they have their new categories. And of course, they put out some metrics of what these would determine which category different regions are in. And of course, we heard about an hour ago that Niagara is going to be in the protect category or the one labeled yellow. And these are the metrics associated with that. And I just want to share that from what I've calculated, what it looks like the metrics are right now in Niagara and how that compares to this. So these would be Niagara's metrics. You can see the weekly cases per 100,000 population. If I'm looking at the average over the past 7 days, Niagara is at 37 cases weekly per 100,000 population, which puts us near the top end of that protect range. Our percent positivity of testing, our most recent data on that is again near the top end of the range for protect. Our reproductive number is above 1.0, so that's actually exceeding what should be the case for this metric. In terms of our outbreak trends, you can see that over the past week, we have almost doubled the number of outbreaks, from 11 outbreaks to 20 outbreaks. So we are definitely seeing increasing outbreaks. Good news elements here is in terms of community transmission, and we have this metric on our reopening page that we've actually stayed pretty stable and actually improved slightly and seen less community transmission over the last couple of weeks. Likewise, our hospital capacity doesn't seem to be being stretched yet. But when it comes to public health capacity to case and contact follow-up, we are now getting quite stretched with the number of cases that we have. We are actually beyond our usual capacity, relying on overtime hours, pulling in extra staff on several days this week. And so we are at, I think, a pretty dangerous point at that level. And so when you look at this, we are, very clearly, I think, at least in the yellow or protect range. And I think we're actually getting quite close there to being perhaps moving into the orange or restrict range. And so I think that speaks to me how important it is that right now is a time where we need to be seeing that social interaction really bend in Niagara, or we're going to be heading into that next range. Now, what does this change from being in stage 3 to protect mean for Niagara? I think when you actually compare stage 3 versus protect, it's actually pretty status quo. I don't really see a lot of changes into how, what kinds of restrictions are in place. Going through the list, these would seem to be the most significant changes from my perspective. Dining is now going to be limited to 6 people per tables in bars, restaurants, banquet halls, and the like. There's going to be a requirement for most businesses to have a safety plan in place, so have a thoughtful plan of how they're keeping their staff and their patrons safe. The requirement to provide contact information is going to expand a little bit, so sports, recreational facilities, etc. will need to now keep this. As well, for places like bars and restaurants, where they formerly only had to have contact information for the party, they now need to have contact information for each patron within that party. And that requirement will also be there for any kind of personal services settings, such as, barber, hair salon, nail salons, etc. And lastly, it looks like the province is now going to require appointments for sports and recreational facilities, as opposed to perhaps having them a little bit more open to allow walk-ins. So really, when I look at stage 3 versus protect, it's pretty modest changes in terms of additional restrictions being come in place. And so we're thinking that we need to bend the curve of COVID-19 here by either having more restrictions and or changes in personal behavior to limit this in social interactions. We're not seeing a lot more on the, in terms of the restrictions put on society, at least until perhaps we move into a higher level, such as restrict. And so we're going to really need to rely on people changing their personal behaviors, and particularly cutting down on their contacts, limiting the social interactions, because that's how we're going to bring COVID-19 down. Now, you've probably seen about a week ago, Theresa Tam, our Chief Public Health Officer of Canada, basically was saying something very similar here, that Canadians need to reduce their social contacts down by 25% on average. Otherwise, we're not going to be able to flatten the curve here. And so that's exactly the message that I'm trying to echo here today. I'm going to just show you a little bit of modeling work that has been done by the Public Health Agency of Canada. So this is actually dating back to mid-September, where we are first seeing cases start to rise up in Ontario. And you can see there that, they were extrapolating there some bars of what would happen. And I'm just going to bring up the spotlight here so I can point out. And what they're saying is that based on the modeling, if nothing changed, Canada would follow this great trajectory of cases rapidly rising over actually a fairly short period of time. If people start to have more social interaction and more contacts, we'd actually shift to this orange line and rise even more steeply. It's only if we cut down our social interactions, we would bend to flatten out the curve to look something like this. So that's what it's looking like in mid-September. They updated this modeling in early October, and so this is what it looked like by then. And you can see that we seem to be following that trajectory of actually sticking to a fairly sharp rise. And you can see that gray line is actually not actually very much different than what that orange line looked like. And so again, if we're going to change our trajectory here as a nation, we need to have people cut down on the social interactions to flatten out. Now, we're early part of November. When I look at the Canadian data, we're looking at, on average around 4,000 cases a day. So we've probably actually come to about here. And so the line is maybe not driving as much, as steeply as the model showed. It's maybe diverged a little bit to this area, but it certainly has not come down to what we need. And hence, I think that's why Dr. Tam has been arguing we need to see a change in our social interactions to break up the ability for infection to spread. I lastly just want to point out some of the local Niagara data that we're seeing around this. And looking at the age breakdown of what our cases have looked like in Niagara of late. So this is going to look at how many cases we've had every week across the various weeks since the start of the pandemic. And so you can see that orange group is a young, the youngest group. That gray group, though, quite clearly the 20 to 40-year-olds is the group that's making up the largest proportion of our cases, and it's rising quite steeply. Of note, we're currently in week 44. This is a Monday to Sunday graph. And so we actually have 2 more days of data to add to this. So a lot of these points are likely to rise further up by the time we get to the end of the week. But nonetheless, I think it shows quite clearly how a younger age group in their 20s and 30s really is driving most of the spread and really is diverged from the other age groups in terms of the number of cases. Breaking that down a little bit more into increments of 5-year groups and looking only just up to age 40, just so this doesn't get too busy a graph, you can see again that, once we look at this yellow line and this red line, these are people in their 20s who are really making up the majority of those cases in that younger age group that's rising. And so that's very much the highest risk group that we're focused on, of where we need to encourage people to break up their social interactions. What we're seeing with this group is that they are having quite active social lives, often having many social contacts on the order of up to 10, sometimes getting up to 30 to 40 social contacts that we need to do contact tracing upon. As well, we've seen that they've had social events either in private homes or going to bars, restaurants, and the like to meet up with lots of friends, and that's leading to the spread of infection. Last month, we put out this infographic that illustrated how infection can really, go into settings where people interact, such as this funeral or a workplace or a sports game, and spread across people who then bring it back to their homes and allow more spread there. And we can end up with outbreaks of infection spreading like that. And I just want to show you some details around the most recent outbreak that we've identified. Well, I shouldn't say the most recent, but one of the most recent outbreaks we've identified in Niagara that really actually illustrates a lot of the themes we're seeing from this younger social group. So this is an outbreak that right now has 31 cases as part of it. The median age of this group is 24. So as you can see, very much fitting into that 20-year-old group where we're particularly concerned about. COVID-19, of course, does not respect any sort of boundaries. And so we see that actually these individuals reside across 8 different municipalities. And when we look at the number of contacts these 31 cases have had, it's over 230 contacts that they've had. So of course, public health has followed up with each of these cases and had to then follow up with 230 of these contacts. And of course, these individuals have been out living their lives and potentially spreading infection in other locations. And so what are some of those locations? So I mentioned people have been having events in homes, and so people have visited friends' homes, possibly spread infection there. They visited their home family if they happen to be living away, or they're visiting their parents, etc. And so we're seeing exposure of others in those households. Of course, young people are perhaps playing sports and recreation, and so there's been several exposures occurring in those kinds of facilities. People, of course, need to go shopping to buy groceries, but perhaps buy other things, and so there's a large number of exposures in retail locations. What we see, though, is actually the largest area of exposures actually happens to be at bars and restaurants. And again, that speaks to this is a group that's actually having a fair bit of social interaction in these kinds of settings. And we've detected a fair amount of spread amongst individuals in these settings. I just want to be clear that we're not seeing really that bars and restaurants, they're doing anything wrong in terms of the preventive measures that they're practicing. For the most part, they're actually doing the right thing. The spread we're seeing is people coming together to socialize all at one table, and that's where the infection is spreading. It's not very much spreading from table to table or between tables and staff or the like. So the measures in the restaurant are working. It's the group who actually socializes at that table that's at risk. One other exposure location that I want to highlight here is, of course, I showed in the previous infographic how infection can start to spread through many different settings. And we've identified that in 2 long-term care homes or retirement homes, there has been exposure from this outbreak. And of course, that is putting the most vulnerable people amongst us at risk of infection. I can't categorize all of the other exposure locations. We do have another 17 exposure locations that we haven't categorized here, for a total of 112 places where there have been exposures. And I mentioned earlier on how we in public health are really seeing our capacity maxed out now by managing all of these cases and contacts and following up with risk in the many places where there could have been exposure to others. And this, I think, really illustrates how, what all started with one case has spread rapidly to many more cases, led to hundreds of contacts, led to over 100 locations where we've had to investigate, assess the risk, and in some cases do follow-up leading to some of those contacts. The one other thing I want to add here is that you've probably seen there's a fair number of outbreaks in Niagara right now. We're reporting 20 outbreaks total. We've just identified that actually one of those other outbreaks that's actually linked to spread within a bar actually ties back into this outbreak now. And so it's going to actually be folded into this outbreak. And so we now actually have another 10 to 12 additional cases as part of that outbreak when we fold that in. And we haven't yet been able to run the numbers on the contacts and other exposure locations. But that, I think, continues to show how this infection continues to spread through over the course of multiple weeks and is spreading quite widely. And so really the final comment here I want to make is that the name of the game right now is we need to be breaking up our social interactions in Niagara to prevent the spread of infection, and particularly focusing on that young group to do that. And that means people need to be staying home as much as possible, interacting only with their households so they have the smallest social circle as possible and the limited number of contacts they could be spreading infection. If people have symptoms of illness, they absolutely should be staying home and getting tested so they're not spreading that illness around to others. Unfortunately, what we have seen with this young age group is often they have mild symptoms like a cold, they disregard it and they've gone out with their social lives, and that's partly why they continue to spread infection. And of course, the usual messages about keeping 2 meters distance, which is another way we break up social interaction, washing our hands frequently, wearing face coverings, all of that is going to help us limit the spread of infection. But really the key parts right now is really sticking to just our household in terms of our social interaction, staying home if we're sick, because that's how we break up the social interaction that leads infection to spread. And so I'll turn it back over to you, Meredith, now for questions.
Great, thank you, Dr. Hergy. So let me go back to this different view here. So now we're going to turn it over to you folks to ask questions. So CKTB is up first. So I see Abby and Bonnie was there. Is Bonnie still here? Oh, there you are, right in front of me. Okay, so I will unmute you both. You could choose who's going to ask the question.
Hi. Can you guys hear me okay?
Yep, I can hear you well.
All right. Thank you, Meredith, for putting this together. Thank you, Dr. Hergy, for taking our questions. I'd like to talk to you about outbreaks. As you've mentioned, we have 20 in the region. We only really know the location of 7 of them because they're listed as healthcare facilities and the region releases that information. Why aren't we releasing more information on locations, whether it be, you know, an outbreak at a store or a rec center? Why aren't you releasing more information on the location of those outbreaks like other communities so residents can make more informed decisions when they are interacting in the public?
Okay, so thank you for that question. I think that's a question that we hear quite often. And so what our goal here in public health is, I think, exactly what you're saying. We want to give the information to the public so that they can make the decisions that they need to make to protect their health, as well as protect the broader community. At the same time, we always want to be mindful of privacy of individuals so that we're not possibly disclosing too much information that could allow individuals to be identified. And at some level, you know, there's volumes and volumes of data that we can provide out. You know, we just showed that there's 117 exposures linked to that outbreak. If we, for example, started to list every exposure and everywhere people have been, we would be literally putting out lists of 60, 70 places a day and would multiply. So at some level, we're also trying to curate the information we put out to make sure that, you know, within all that volume, we're giving the public the information that's most valuable to them and is going to be most useful to them, and not necessarily information that might be a little bit of a distraction. And so when it comes to outbreaks, what we try to do is where there's a location where there's going to be risk to the public and they need to know that this risk affects them, or they may have been in the location where we think there is risk to them, we would want to put that outbreak out so that they're aware and so they know that they are potentially at risk and they can follow up or they can make decisions around that. What happens with a lot of our outbreaks is, for example, we identify on this day there was, you know, an exposure at a bar and there was spread of infection on that day. But there's no actual spread of infection on a subsequent day. There's no ongoing risk of that. So, you know, first off, we're finding out about these often 10, 12 days later at a point where the risk is gone. We're still following to make sure we don't identify any additional cases or where the secondary spread goes. But putting out that location would, for starters, be somewhat misleading. In many cases, it could actually violate privacy. We have outbreaks, for example, linked to a private business run out of a home. We don't want to be, you know, providing that level of insight into someone's address and perhaps stigmatizing them. I think if we put out names of certain locations that, you know, a business is linked to an outbreak, it would imply that there's greater risk at that location than any other locations. And that's not actually the case, because there was greater risk at that one day in the past, but not on an ongoing basis. So it might unnecessarily stigmatize certain businesses. And it may also lead individuals to think that, well, I didn't go there, so I don't need to worry because where I've been going is safe. And that's not the message that we want people to be taking away, because COVID-19's risk could be anywhere. We only know after the fact where that risk is. And so, you know, everybody needs to be taking precautions at all times. And so that's some of our thinking that goes into why, when we list outbreak locations or not. Where there is a risk to the public, where this is information they need to know to make health decisions, absolutely we're going to be releasing it. But where we think it wouldn't actually be useful information to them, there's probably a greater risk that we're going to harm someone's privacy than we're actually going to give the public useful information. And so we try to provide high-level information on our outbreaks page in terms of the categorization of outbreaks, you know, the kind of age groups that are impacted, that sort of thing, but not necessarily going into the specifics, which we think would be a little bit of a red herring and could lead to stigmatization and privacy violation, privacy being infringed upon.
Okay, a follow-up, Bonnie?
Yeah, I just wanted to talk briefly about the color-coded system. And Dr. Hirji, you just you noticed that we had been moved up into the yellow zone, and we talked about the restrictions, and there really aren't that many. You've said a few times this week that now is the time Niagara residents should really be limiting their contact to their households. If you made the call, where would you put us on that scale? Would we be at a higher level than what we're placed in right now? Yeah, so the province has laid out the metrics, and I think the metrics, you know, in fairness, when you look holistically at them, we are placed appropriately in the protect range. But as I showed, we're getting very close to this restrict range. So I don't know if we will stay in protect for very long if we continue on our current trajectory. You know, I would absolutely be thinking about where are perhaps, you know, targeted additional restrictions that could be put in place
to address where we see the greatest risk of infections. For example, with these young groups and their social interactions. We identified that bars and restaurants are one place where that is happening. So perhaps some additional targeted restrictions there, particularly to perhaps break up people going out with friends, to limit it to households so families can be out dining, but maybe not larger groups. The other thing I would be focusing on is better enforcement of the existing rules. Of course, large house parties shouldn't be happening right now. That's currently not allowed by the current rules, but we do keep detecting that they are occurring. And so I think if there's better proactive enforcement of the current rules, we could hopefully keep cases down low enough that we don't need to bring on additional rules that make it more difficult for our businesses to survive.
Great. Now over to Grant LaFleche. You should be able to unmute.
Hi, Dr. Hergy, can you hear me okay?
I can hear you well.
Perfect. Nice to actually see your face as opposed to just your disembodied voice, which is how we usually communicate on a daily basis. Thank you for Meredith for setting this up and taking our questions, Dr. Hergy. I want to sort of dovetail to begin with off of Bonnie's question about the, this color-coded alert status. As you and I spoke about, back on Monday, we moved to yellow, which is expected. But given the data that you've seen all week, and in fact, going, sort of even middle last week till now, and we know that stage yellow does not actually change our status quo very much. The question is, how effective really will stage yellow be if we're seeing 20 outbreaks? That cluster of cases you just walked us through that we've been talking about all week is still growing. Should, just in terms of the ability to limit the spread of the virus, status quo has not worked. So do we actually need, from a public health point of view, regardless of how the province has set their metrics up, move to a more severe setting, an orange setting perhaps, in order to actually have a practical, meaningful impact of the spread of the virus in the region?
Yeah, so I think if we want to have an ability to flatten out that curve of infections and bring it down, the modest additional restrictions probably aren't going to get us there. I hope to be proved wrong, but they won't. But reducing the spread of infections, I think the province is taking this approach that it's not all about what the restrictions are in society. We're also expecting some level of personal behavior and personal choices to impact that. And it's the combination of that. And with the province bundling us into the protect category, I think their expectation is that the public still needs to do more on their part, and they're expecting the public to do more. Otherwise, we're going to head into the next stage of restrict, where they're going to put on those additional restrictions. And so I think the onus is very much based on this system, on the public still, to do what it takes to help us bend the curve and stop going into restrict.
On the question of bars, and again, that map that you showed us of the cluster cases, and while he was speaking, by the way, Meredith, I shot you an email. Is it possible to get that graphic sent to us in its totality? Would be very helpful. But you said, Dr. Hergy, that the restrictions in place now, like the restaurants are doing the right thing. It's not an issue that the restaurants are doing the wrong thing. It's this cluster and this demographic that's sort of causing this virus spread. At the same time, we know that the Niagara region is actively considering imposing different or new restrictions on bars in the region. So when you say they're doing the right thing, and then on the other hand, we know the region is actively considering using your authority under the Health and Promotions Act to perhaps impose further restrictions, how do we reconcile those two things?
Yeah, so I think one of the unfortunate things when you're dealing with the health of the public is that you can't take an individualistic approach to it. Any individual's choices affect other individuals. Anything that happens in one business might affect other people in society. And what I'd say is that if I'm thinking about whether or not more additional targeted restrictions are needed in business, it's not because businesses are doing wrong. It's not a punishment to businesses. They're doing the right thing. But regardless of them doing the right thing, unfortunately, it is still leading to the spread of infections in society. And unfortunately, if we're going to try and limit that spread of infection, it's going to result in some additional restrictions perhaps being necessary in those kinds of settings. This would be the same argument that goes to lots of kinds of businesses, for example, that have not been able to reopen. It's not that, those businesses are, malicious actors doing something wrong that's causing infection to spread. It's just the unfortunate nature of the kind of, line of work that they're in, that in this moment in time, there is a risk of infection spreading through no fault of their own. And we've had to, the government has had to force them to close in order to limit that spread of infection. And in a smaller scale, that's what it means for, bars and restaurants were there to be some additional restrictions put on them.
Thank you.
I am on mute. Here we go. Over to Brian. I'll unmute you.
No, thank you, Meredith and Dr. Hergy. I just kind of wanted to know, I guess, 9 months into this pandemic now, and we're seeing cases rise in Niagara. I kind of wanted to know what role you see as kind of a COVID fatigue and fatigue on the part of the public playing with those numbers going up, and then kind of what challenges exist from a public health perspective in keeping those numbers down so that we can remain vigilant in the fight.
Yeah, no, I think everybody recognizes that there's COVID fatigue. I'm sure every single one of us is feeling that. And, I totally understand how people are really struggling to continue up vigilance, with it really looking like it's going to be many more months at least before we have a vaccine, and maybe we are able to recalibrate the, practices that we've had to change and all the disruption in our social lives. And if anything, with cases going up, I think, many people may be feeling quite disheartened that they might be doing quite a lot already, and it doesn't seem to be enough yet. So, I totally appreciate that, and I totally understand that. The sad state of, the situation is that, the cases are rising, the numbers are going where they are, and the only way we address that is either by reducing social interaction through restrictions on businesses and social life, or by us voluntarily limiting our social activities. And, it's just the hard truth of the situation that nobody likes and nobody wants, but unfortunately that's where it is. In terms of the challenge of trying to motivate people, I think that's a really difficult question. And I think the challenges was probably different between different social groups and different categories of our society. You work in the media, and I'm sure you have certain targeted groups where you're doing your, targeting to get audience because, these are more likely to, in your case, listen to your radio channel. I know your advertisers are probably paying attention to that and choosing where they advertise based on what is a target market and who is most likely to buy their products. And so I think we're always trying to figure out and think about that as well. And who are the, different categories of people in society, and how do we best target a message that motivates them? We're trying to use more and more information that helps inform this. We're using market segmentation data that the private sector would traditionally use to see what can we leverage from that to help us better tailor messages. What can we find from research evidence where people have studied what's been done elsewhere in the world and learn from that? I meet weekly with my colleagues to discuss with them what are some of the lessons they're learning, what may be working for them, to see if whether or not we can adopt those there. I think it's really just about continuing to try and, figure out how can we improve, test things out, see what the impact is, and continue to try and, adjust as it goes.
Follow up, Brian?
Yeah, just kind of going off of that, I guess, do you think that just given the time of year that we're going into, coming into the winter months, do you think that that will pose some additional challenges that maybe we didn't see in the summer? So does it kind of, from a public health perspective, does your strategy change, or do you think there'll be any challenges that we could see in the winter versus the summertime that we didn't see?
Yeah, no, I think there's absolutely some different challenges in the winter as opposed to the summer. The most obvious one is not necessarily about the weather itself, but just where we are in terms of our cases. There's far more cases in society right now, so there's much more risk. And so obviously that recalibrates our messaging. Perhaps it helps as one element that might motivate, but we know not all groups are necessarily motivated by the health risk out there. There's, of course, overwhelming evidence, for example, smoking is harmful, but some people are not motivated by that alone to change their behavior. And that is probably the case with some people when it comes to COVID-19. Other challenges, though, of course, with it being winter is, of course, people are going to be spending more time indoors rather than outdoors. And when you're indoors and there's walls, that creates a natural restriction on your ability to spread people out and have the same level of physical distance. With a restaurant, for example, if everybody can only dine indoors, you've actually also reduced your capacity to actually, have a large patio that maybe stretches out onto the street and actually be able to really spread out your clients much more. So there's absolutely, I think, a much greater risk as we head into the winter of this happening. And I think the other challenge, of course, is that this is a time of year where people get colds, people get respiratory illnesses, and there's a possibility people are going to discount the symptoms they get as just being a cold, rather than the summer where that's less common, that they might be more vigilant about noticing that I have this unusual cough, or I have an unusual congestion or sore throat, and think that this could be COVID-19, whereas now they might be more likely to think this is just an unusual cold and maybe not think as much of it.
Thanks.
Okay, up next is Ludwig. I will allow you to unmute.
Thanks, Meredith, and thank you, Dr. Hergy, for taking the time for this today. I want to ask you about the fatalities. We've seen an uptick in deaths recently. Where are those happening? What can you tell us about them? What are you able to release on origins, residents of care homes? What's happening?
Sure, yes. So, I think really since the start of October, which is shortly after our cases spiked in the latter part of September, we have seen an increase of deaths from COVID-19 in Niagara. And I think we are up to 11 or 12 deaths total in that time. What I can say is that this group has been overwhelmingly an older age group. Most of them have been in their 80s or above. A few have been in the 60 to 70 age group. And the other thing I can say is that they've overwhelmingly been in long-term care home and retirement homes. So it's very much the group that we saw that is unfortunately at risk of dying back in the springtime when we went through the first wave. And we're seeing, of course, that group is again at risk. And one of the best ways of reducing their risk is, of course, if there's few cases out in the community, there's few cases that can spread it to someone who happens to work in a long-term care home or retirement home, fewer cases that could spread to someone who's going to be visiting a loved one in a long-term care home or retirement home, and therefore there's less risk of infection getting in. I don't think it's a coincidence that, well, I guess it is a coincidence when you take the literal meaning of the term. It's not a surprise that as cases rose in the latter part of September, that has led to more cases, more outbreaks in long-term care home and retirement homes, and unfortunately, therefore, more individuals in those settings passing away.
Follow up, Ludwig? You are on mute.
There we go. Thank you. I apparently can't unmute myself once I've pulled the trigger. All right. And as far as the long-term care homes go, I believe at least one was put under some type of provincial mandate due to the development we're also seeing today. Seasons Welland, that I believe was one of the hardest hit care homes in the beginning of the pandemic with a pretty long-standing outbreak going on. What can you tell us about the situation as far as containment measures and the long-term care homes' abilities to take care of this? I know you had rapid response teams that kind of went out and advised and helped, and you expressed more than once concerns over how management responded and complacency in pandemic protocols and such. So can you fill us in? What's the landscape looking like there?
Sure, and if I may just slightly correct, I wouldn't necessarily say it was complacency in the pandemic precautions. I think all the pandemic precautions weren't being practiced. I don't want to necessarily ascribe the motivation to that. What we've seen, I think, in this wave is that, of course, long-term care home and retirement homes, having learned over the past 6-7 months, are actually in much better situation. There's a lot of work that they have done to prepare in terms of stockpiling personal protective equipment, in terms of better understanding their outbreak prevention measures and training their staff. There's a lot that we have done in public health as well to support that. We've had teams go out regularly to all of our long-term care homes and retirement homes to do inspections to really make sure everybody gets up in terms of the measures they have in place at a baseline. We've had teams that go out to do coaching and support in terms of best use of personal protective equipment. We did some simulation with some of our long-term care homes of simulating what an outbreak would be like so that they could start to see where are the things that start to fall apart and what are the gaps that they can likely expect so they can start to patch that up. And so I think as a result of that, we've actually seen far fewer cases within the outbreaks that we've seen in long-term care homes and retirement homes. And so I think there has been some definite success there. It obviously hasn't been absolute. There are a couple of larger outbreaks when it comes to Gilmore Lodge and Millennium Trail Manor currently going on. Certainly not the same size as the ones we saw in the spring, but certainly larger than anybody would like. Many of our outbreaks though are actually much smaller, often not really getting any larger than the small single digits. And I think that's a reflection that in many cases, they're doing a very good job of jumping on top of the initial spread and are able to smother it before it spreads any further. Final comment, you mentioned Seasons Retirement Home as being one of the homes that went into outbreak in the spring. You know, the other two large homes that had very large outbreaks were Lundy Manor and Royal Rose. And of course, both of those have actually had outbreaks subsequent to the spring. And what we've seen is actually those outbreaks were actually quite short-lived. And I think that's another example of how, you know, these homes that maybe struggled the first time around are actually a lot better prepared this time around, or not seeing those large outbreaks again. And we're certainly hopeful that will be the experience with Seasons Retirement Home as well.
Okay, great. And last up, I believe that is Penny on the phone. Last four digits, 5878. Unmute you. You should be good to go, Penny.
Thanks. Thank you very much for organizing this and giving us all the chance to participate. My first question has to do really with a follow-up to what Grant was asking. I listened to Dr. Hergy. You were telling us that the main message is for young people to start to make better choices and to restrict their own behavior. And I'm wondering what at this point would make you think that you're going to be successful with that message, and why you wouldn't, not as a matter of punishment, but to make sure that this is effective so that we don't see an increase in cases that see us go to orange or red, why you wouldn't impose some of those restrictions and enforcements that you were talking about earlier that you could now, rather than waiting to see what happens and whether this request for young people to self-regulate, whether, you know, wait to see that it works. What's the harm in changing some of your guidelines and restrictions now? What's the downside?
Sure. So, you know, I think the harm there is, of course, to the economy, to our local businesses who would be affected by this. What we're, I think, trying to do in Ontario is we're trying to find a balanced approach where we, you know, allow enough freedom so people can live their social lives and the economy can recover, while still having enough restrictions that, when paired with personal choices, leads to a flattening of infections in society. And so we are always very mindful that we don't want to upset that balance too much. We've of course seen, you know, in addition to the pandemic being a health crisis, quite the economic crisis result in Canada as well. We've of course seen lots of businesses struggling, many businesses go under, many people being out of work as a result. And we're very mindful that those have serious social and health implications to people as well. And so what we're trying to see is that, can we find a balanced approach, maybe adjusting where we currently are, and see if that leads to some improvement, by continuing to encourage the young people and really lay out in quite stark terms that we're now right up the line of moving into that restrict category. There are going to be additional restrictions on business. The people who aren't cutting down on their social contacts and letting infection spread, they're actually going to be responsible for the additional economic harm that those individuals go to. You know, I think it's worth giving one last try for people to hear that message, to understand what the implication of their choice is going to be, and hope that it has an impact. And if it doesn't, Niagara will, I think, move into that restrict category, and we will see additional measures put in place by the provincial government at that point, which unfortunately will harm our local businesses and harm our economy in the name of ensuring that we don't see unsustainable spread of COVID-19.
And a follow-up, Penny?
Thank you very much for that. That was very helpful. My other question is actually not a follow-up. It's totally different. If you don't mind explaining to me, I'm not, data analysis is not my strong point. And I understand that although we see the number of cases going up in recent weeks, sometimes as high or higher as last spring, the number of positive, the percentage of positive results from testing is quite considerably lower, I think, than what it was last spring. What does that tell you?
Yeah.
How do we interpret that?
Sure. Yeah. And, I think we saw percent positivity as best that we could measure it around 7% as the peak, I think, in the spring, in that ballpark in Niagara. And right now we're looking at a percent positivity of 2.3%. So if you're thinking about this mathematically, that percent positivity is, number of cases that test positive divided by the number of total people tested. And so that, the number of cases is similar or higher, but the percent positivity is lower. That implies that we have a lot more testing going on that's keeping that percent positivity lower. And so what I think that implies that unlike in the spring, right now there's much more testing going on in terms of COVID-19. And so we can have more reliable sense that we're hopefully finding most of the cases out there and we're not missing as many cases of COVID-19 that may have been out there. I think that's really the biggest thing that percent positivity difference from the spring versus now tells us.
Okay, thank you.
Okay, so we have about 10 minutes left. If anyone has additional questions, we can maybe do a lightning round. So I'll throw, Grant, you do? Okay, so I'll throw it to CKTB first. So Bonnie or Abby, you can unmute.
I actually do just have one small quick question, if I can.
Sure.
So Dr. Hirji, you said that most of the cases are in my age group. So then what are some of your fears and the messaging, if you will, as we move closer to Christmas? Because my fear would be that people my age are still going to host their own little holiday parties and that sort of thing. So what would you say to people who are still thinking about doing that, regardless of the fact that we're in a pandemic?
Yeah, and just to be clear, it's not most cases are in that age group, but definitely the plurality of cases is in that age group, just to be clear on that. I think, you raise absolutely the kinds of concerns that we have, that individuals who currently haven't bought into the advice around limiting the spread of COVID-19 and are still continuing to have larger gatherings, are still continuing to have very active social lives where they interact with others, they're going to perhaps continue to do it. They're going to find reasons to celebrate at US Thanksgiving time. They're going to find reasons to celebrate at Christmas time. And unfortunately, we will continue to see more and more infections spreading. I think, I would also worry about even things like, as we head into the Christmas season, are more people going to do more shopping? And are those going to be quite crowded locations? Because that's going to be the social activity that people are going to be partaking in. So those are the kinds of things that we are quite worried about happening in the coming months, and hoping that we're able to convince and motivate the public, and particularly this younger age group, not to partake in that as much.
Okay, Grant, over to you. Quick question.
Thanks, Meredith. And I'm not sure if you heard me before. Is it possible to get that graphic about the cluster that Dr. Hirji showed us? Yes? You got it. Yeah, great, thank you. We can get that this afternoon. It would be super helpful. Dr. Hirji, just really two quick follow-ups from our previous discussion. The first is, do you have any sort of timeline on when you may make a decision as to whether or not you're actually going to use your authority under Section 22 to impose any kind of further restrictions on local bars? And then just to your comment on increased enforcement under yellow alert to try to keep down, I mean, is there anything that your department can do or that the region should be doing in order to actually practically push that out? Because one of the complaints I think the public and businesses have had has been the very low level of enforcement up until this point.
Okay. So on the issue of a Section 22 order, and if we do it, we have no timeline. We're always exploring what our many different options are and consulting widely to get feedback from key stakeholders on that, and whatever deliberations we make will happen at the timeline that they get made at. In terms of your second part and the level of enforcement, the province has really laid out that municipal bylaw offices are the front line for enforcement, with the police then being the backup at certain other times. And I think particularly if it is going to be in a home location as opposed to in a business location, the police would take the lead on that. We've certainly had conversations with them to encourage that there needs to be more proactive enforcement, and certainly highlighted some of what we're seeing as things that seem consistently not to be practiced, and hopes that that will be taken up. I think perhaps one of the challenges municipalities are facing is, of course, they have faced quite the budget crunch this year in adapting their operations to COVID-19. And the province hasn't really put out any kind of dedicated funding to support enforcement. And so that's something that I would like to see the province do, is really have a, more of a strategy around enforcement, around making sure that there's sufficient funding for enforcement agencies, maybe even bringing in additional staff to support those enforcement agencies so they can get their usual activities done, as well as proactive enforcement around COVID-19 restrictions.
Thank you, sir.
Okay, Brian, do you have a follow-up?
No, I think I'm good.
Okay. And Ludwig, what about you?
Nope, all set. Thank you.
And finally, Penny.
I'm good. Thank you very much, and thank you for this afternoon. It was very helpful.
Okay,
Thank you, Dr.
great.
Hergy.
You're welcome.
All right, well, thank you very much for bearing with us while we work through technology.
My
thanks
apologies for not sharing my screen.
We were trying to chat with you privately to let you know. So thank you for attending. I'd love to get some feedback if you liked this format, if you found it informative. I think we'd like to kind of move in this direction in the future, especially when we have several updates that we want to get out kind of at once. We hope this was a good format for you. And with that, I'll end the session. Thank you very much.